So hey guys, hello and welcome to my YouTube channel again. And as you already know that we are studying the gallbladder pathologies and we have covered the biliary colic and the acute cholecystitis. In this video, I'll be covering two important pathologies which arise due to the gallstones, and these are the ascending cholangitis and the gallstone Alias or the Gallstone Alias. Okay, and in our next video we'll talk about the chronic cholecystitis and porcelain GB and gallbladder carcinoma because they are related to each other. First of all, let's talk about the ascending cholangitis. See guys, this is the gallbladder, this is a cystic duct, this is the common bile duct, and this was the stone that was lodged in that cystic duct. Now imagine that this stone, it passes and lodges in the CBD. Okay, let's assume that the stone has passed from the cystic duct and it has lodged in the CBD. So as a result of this, there will occur the infection. There will occur the infection in the CBD because I have already told you that whenever there occurs an obstruction, before that obstruction there occur, or proximal to that obstruction there occur the infection, because there will occur the stagnancy in the fluid, and the stagnancy in the fluid is the number one factor that will lead to the infection. Now this infection of the CBD, it is called as cholangitis. Now you are clear, and if anyone asks you what is cholangitis, just quickly answer that sir or ma'am, the inflammation or the infection in the CBD is called as the cholangitis. Now if we talk about the cholangitis, there is a specific there is a specific triad which is present in a patient with the acute cholangitis, and this triad is called as Charcot's triad, and most of the few people know what is Charcot triad. In the Charcot's triad there are three main important points, and these points are: number one, first of all, there is fever, because you know that whenever there is infection there is fever associated with that. Number second, there is something which is called as abdominal pain. So there is something which is called as the abdominal pain. And third, there is jaundice. Now what kind of jaundice is that? Obviously it is a kind of obstructive jaundice. So it will be a kind of obstructive jaundice. So in case of acute cholangitis, there will be obstructive jaundice, there will be abdominal pain, and there will be fever. Now sometimes the condition gets worse, and there is a phenomena, or there is a finding which is called as Reynolds pentad. Now in this thing, what happens over there is that there occurs sepsis. As a result of sepsis there occurs shock, and shock leads to hypotension. So if there is hypotension and there are neurological findings, because obviously due to shock there will be decreased perfusion in the brain, so as a result of shock there is hypotension, there is neurological findings, and this thing, that is Charcot's triad plus these two things, they constitute what is called as a Reynolds pentad. So this is the whole idea regarding the ascending cholangitis. But please don't remember the obstructive jaundice, abdominal pain, fever. And obstructive jaundice obviously will have elevated conjugated bilirubin, and along with that the ALP will be increased, because I already told you whenever there occurs a damage to the ductal epithelium, ALP is raised. So is ALP raised in case of all the obstructive jaundice, including the ascending cholangitis. Now let's talk about another pathology which is called as the Gallstone Alias. So let's talk about the Gallstone Alias, like how does this thing happen. First of all, remember that ileus is nothing but it is a kind in which it is a situation in which there is bowel obstruction. So ileus is nothing but it is a situation in which there is an bowel obstruction. Let's say this is the bowel and there is an obstruction. This will result in what is called as ileus. Now ileus may be of various types. Let's say there is some kind of mechanical obstruction. Sometimes there are changes in the electrolyte balance. Let's say the potassium it goes down or the calcium it goes up, then it also can cause the ileus. Now in this case there is something which is abnormal with the gallstone, and it is causing the ileus. So therefore it is called as Gallstone Alias. Now let's take on how the gallstone it causes the ileus. See guys, this is the gallbladder, and this is the stone, and there are also stones in the gallbladder, and this is the CBD. Right in the vicinity of the gallbladder are the loops of the intestine. So right in the vicinity of the gallbladder, there are loops of the intestine. Now what happens over there is that there occurs acute cholecystitis, as I already told you. Now, as a result of the inflammation in the wall of the GB, the wall of the GB will weaken, number one, and also there will be a spread, or there will be a communication of that infection and inflammation with the adjacent bowel. So as a result of that, both the GB and the segment of the bowel, they will be inflamed, and there will be a formation of a fistula or a communication between the gallbladder and the bowel segment, which is called as cholecystoenteric fistula. Now why it is called as cholecystoenteric fistula? Because there is the GB, there is the bowel which is called as enteric, and there is a communication which is called as fistula. So it is called as cholecystoenteric fistula. So we have the formation of the cholecystoenteric fistula. The next thing that happens is that the stone which was in the gallbladder, it will just go into the intestine, and it will lodge somewhere in the distal segment of the intestine, because they are the narrowest, and as a result of that there will be obstruction in the bowel, and this will lead to what is called as Gallstone Alias. So therefore there is an complication of the cholelithiasis, which is called as the Gallstone Alias. So this is all about the video regarding the ascending cholangitis, Charcot's triad, Reynolds pentad, the Gallstone Alias, and what is the cholecystoenteric fistula. In the last part of our video, we'll talk about the chronic cholecystitis and what is the porcelain GB.